every other person, okay, joining this session, this live stream from any part of the Nigerian university offering the course called Anatomy. Okay, and any other person joining from any other part of the world who may be watching this video, okay, wanting to learn one or two from this video. Today, we are looking at today we said let's tap the limbs. Let's tap our limbs. That's the goal. In today's stream, we'll be tapping the limbs. Okay. What does it mean to tap the limbs? Stay patient. Watch how we go. First, we look at this structure called plural, right? Then we look at the structure called the mechanism called breathing mechanism. So please stay with me as we tap the limbs. We say we'll be going to be an expose on thorax, okay, abdomen, pelvic, and perineum, meaning we're going to say one or two things that connect with that. And then we are going to also touch the limbs, the upper and the lower limbs. Do you follow? Okay. All right. So let's continue. Let's start immediately. We're looking at anatomy of the plural. Okay? Anatomy of the plural. Don't forget, this is MSC Course Mastery. In MSC Course Mastery, we master, okay, anatomy concepts, not only anatomy, but the courses in medicine and surgery. Okay, not only the courses offered by medicine and surgery students, but provide any other department of other course too. We master those concepts and concerns in piecemeal. What that means is little by little. Okay. So moving away from there, we start with the plural. What is the plural? The plural, okay, is a membrane, all right, that lines, okay, the lung. The plural is a membrane that lines the lung. Do you follow? Good. The next one we want to look at is the pleural cavity. Okay, the pleural cavity encloses both lungs and is lined by the pleura. Do you get the point now? Now, meaning the pleural cavity is a potential space. Okay, is a potential space. It is enclosed by the lung. Pleural cavity is enclosed by both lungs, that's the left and right lungs, and the what? And it is lined by the pleura. Do you follow? Now, the pleura consists of two membranes, the viscera, which adheres to the lung tissue, and the parietal, which lines the thoracic cage. Do you follow it now? So we are talking about something new now, and that is the pleura. We've said that the pleura is a membrane. It's a membrane that lines the lungs. And we say the pleural cavity, okay, the pleural cavity is enclosed by the two pleura, and the by the two lungs, and the pleura. Do you follow? Now we say the pleura is divided into two, the viscera and the parietal. You say the viscera lines the lung, okay, while the parietal lines the thoracic cage. Do you follow it now? So meaning the parietal separates the lungs, okay, from other structures in the thorax. We are making progress. Now, these are the points we are picking. Between the two layers, there are potential space called the pleural space. Okay, so the pleura is a lining, okay, for the lungs, whereas in between the pleura is a pleural space. Whereas the pleural cavity, okay, is a space. All right, so this way. You see now, this is the pleural space. See the pleural space now? Okay, pleural space. Okay. Now, whereas the pleural cavity, okay, is between the two lungs. So where you have three, that space there is a pleural space because we said it is enclosed by the two lungs. Okay, all right, let's continue. So we have pleural cavity, we have pleural space. Pleural cavity, okay, we have pleural space. Okay, between the two layers, pleural space equals to viscera minus parietal. That's the space between the two layers. Okay, now the next thing we are looking at, we said the term pleural space contains a serous fluid. All right, contains a serous fluid. That's a lubricant. Now, I want to pause here because this is exactly 6 minutes. I want to pause here and connect, all right, the upper and the lower limbs to this. Do you follow me now? Okay. Now, we said, as we talk about this concept, we are saying that the plural, watch closely, the plural has what? Lining. And this lining connects with the upper and lower limb because in the upper and lower limb, you have what? You have histology. You have anatomy. Now, we are coming from the angle of histology. Plural, okay, is histological. Plural is histological. What do we mean? When we're talking about the examples of histology, we said celamere, S for skin, E for ependyma of the brain ventricles, L for lungs, and then A for alveolar, M for mesothelium, E for endothelium, then L for lining of cavities. Those lining of cavity, okay, is where plural come in. For example, the peritoneal cavity. Another one, the serous cavity. Another one, the pleural, okay, cavity. What lines this cavity is what? Is the plural. Are you following it now? This is the connection. Is the connection between thorax, okay, and the upper and lower limb. All right. Now, that's histology of the upper and lower limb. We're making progress. Let's move on. The term potential suggests that the two pleural membranes are directly adherent with no intervening space. They're directly adherent with no intervention. So this can be a likely question you might see in an OBJ. See, when we say potential, what does it mean? What does it mean? It means those layers are slightly they are directly adherent. Okay, there's direct adherence. They're directly adherence. That is, they are directly joined. Okay, they're directly joined with no intervening space. Okay, no intervening space. This is a serious internalization session, and I want you to be picking the point as we are picking. First, we started by what a plural is. We said it's a lining, okay, it's a lining on the lungs. Next, we move on and we said the plural, okay, has a cavity and has the space. The pleural cavity is enclosed by the two lungs and what? And by the pleural. Is enclosed by the two lungs and the pleural. Okay, that's what we said. Okay, it's enclosed by the two lungs and it's lined by the pleural. Whereas the pleural space is the space between the parietal and the viscera. And then we move on to talk about this pleural again. We said that the that there is a serous fluid in between the pleural and the parietal and the viscera. And now we said that potential space, okay, when we say potential space, that there's a potential space, it means that those layers are joined together with no intervening space, all right? No intervening space. However, in reality, a narrow pleural space exists between them, which can accumulate fluid or separate the two layers. Are you seeing it now? Meaning, even though we said it is joined together, no intervening space, in reality, All right, there's a narrow space. Are you seeing it now? So potential means it's joined together, no intervening space. But we know in reality something like fluid, okay, or fluid, okay, or it can even separate into two layers. It's possible. All right, let's move on. Next thing we are looking at is the function of the plural. The function of the plural. We've finished the introduction. We are looking at the function of the plural. Okay. Now, the first function is protection. The next function is lubrication. PL. Okay. PLC. Function protection, lubrication, all right, and container of serous fluid. Okay, so it protects, it lubricates, okay, it protects, it lubricates, all right, during respiration. Now, as this thing is moving, is extending, guess what? The upper and lower limb are getting blessed. Yes. Because when there is no breathing, when there is no what? No breathing, the lungs is not performing its function, the upper and lower limb will be tired. Okay, but we are not looking at it in literature comparison. We're looking at it in the plural. This is a visceral organ. The visceral organ. This is what you find in the cavity. All right. Let's look at the related clinicals. Let's look at the related clinical. So what you call clinical significance. And also in upper and lower limb, you need to know like about 5 clinical significance, okay, of a structure. And some clinical significance are common to all structures. For example, to all bones, fracture is common. Yes. And then ligament tear is common. Okay. Injury to artery is common. Bursitis is common. Okay. Do you follow? I've mentioned how many now? 3. Osteoporosis is common. That's 4. Okay. Damage to nerve is that's 5. Because these 3 things, nerve supply, blood supply, bone integrity, and all that gives the joint what it is. So now we are looking at plural. The first one we said pleuritis. That's the first one. Pleuritis. The second one is what? Pneumothorax. Remember what we talked when we talk about accumulation of, when we talk about diaphragm, and we said a diaphragm can collect air, and we make mention of pneumothorax. Okay, so pleuritis, let's put it this way: pleuritis, hemothorax. Let's start with hemothorax. Hemothorax. That's if blood, okay, is happens to be in that pleural space, that potential space. All right. And there we talk about the next one, epen, ep, empyema, empyema, empyema. All right. And then the last one, pleural effusion. Pleural effusion. Now, why am I taking this way? Because I want to form an acronym. Okay, I want to form an acronym. All right. And the acronym I'm forming to remember the clinicals 1, 2, 3, 4, 5 is what? FIP. FIP can be somebody's name, FIP. Okay, FIP. PHEP. Or you can say PHEPE, no problem. Okay, but the first P is for what? Pneumothorax. Okay, pneumothorax. Either you pick pneumothorax, okay, or you pick what? Pleuritis. So that's that. Pleuritis, pneumothorax, and then the last one, pleural effusion. Pleural effusion. That's when you have fluid in the plural, and you have fluid in that potential space, which we said is directly adherent, okay, to each other with no intervening, okay, space. Yet in reality, there's a narrow space that can even separate the two. All right, and then even separate the two layers. That's the viscera and the parietal pleura. All right, I'm going to begin from the beginning again because repetition brings retention. Repetition brings retention. So I'm going to repeat again before we've just introduced pleura. Okay, pleura is one of the things that tap structures leading to the upper and lower limb, the nerves, the artery, and all that. During breathing, there's extension. As a matter of fact, we said the diaphragm can move on normal breathing 1.5 centimeters, but on deep breathing can move as high as 6 centimeters to 10 centimeters. Can you imagine that? That's why the diaphragm is a serious muscle. Okay, okay. Now let's move on. Let's move on. Remember, we said the diaphragm is the chief respiratory muscle. And now we are looking at the pleura again. The pleura is so important because it helps in PLC. That is, it helps in protection. It helps in lubrication. Contains serous fluid between the pleural space. Okay? And we said the pleura is a membrane that lines the lung. All right? Now, we said there's a pleural cavity. Pleural cavity is enclosed by the two lungs where you have the tree. And then you also have the pleural as a membrane too. All right? Enclosing that. All right. Now we talked about the clinical significance and we say FIB. Okay, FIB. P-H-E-P-P. P-H-E-P-P. Either you say FIB-P or P-FIB. All right? FIB-P or P-FIB. Or FIB-P. Okay, or P-FIB. Whatever, the FIB is there. You follow? All right. P-H-E-P-P. P-H-E-P-P. FIB. All right? FIB. All right. So we move on. The first P is plurisitis. Pleuritis, not plurisitis. Pleuritis. The next one is pneumothorax. When you have A in the thorax. Talk about pleural effusion. When you have fluid, okay, in the pleural. And we talk about empyema. Empyema is when you have accumulation of pus. We talk about hemothorax. That is if blood, all right, is found in the pleural sac. Hope we are making progress. Thumbs up if you are following. Okay. Now don't forget at night we'll be having live session with a guest. If you want to be a guest, please DM. How do you DM? You have my contact. You know who send you the link. Let them send you my contact, or you look for us in the Med Search Course Mastery. It's a public YouTube. It's a public WhatsApp channel, or you drop in the comment section. You want to be a guest? Drop your number. You want to be a guest? All right. Drop your number, or you drop your Gmail. Okay. If you want to be a guest, we'll notify you. Every night we host a guest. Do you follow? All right. So we are making progress and we are moving on. So we talk about the next thing now, parts of pleura. You may ask, what is pleuritis? That's inflammation of the pleura. When there's reduction in serous fluid, as such, okay, the pleural membrane is decreased. It's extremely painful, okay, where every breath is accompanied by severe pain between the ribs. Yeah. Normally, the potential space contains small amount of fluid, 5 to 10. So the serous fluid contain about 5 to 10 mils. A serous will contain about 5 to 10 mil, which is not perceived. You won't feel it, okay? And serves only a lubricating function. However, the pathological condition, this phase may become involved, leading to difficulty in breathing and other associated signs, symptoms, such as what we've discussed. All right, let's look at parts of the pleura. The first part of the pleura is the cervical pleura. The wall which they are okay. Parts of the pleura. Say parts of the pleura depending on its location. depending on its location. That's the wall which they are associated with. Okay, is it towards the cervical bone? Is it towards the the Simpson fascia? Okay, is it towards, all right, let's look at, is it towards the diaphragm? Is it towards the mediastinum? Or is it towards the costal cartilage? All right, so we're making progress. So we have four types of plural. Four types of plural. Now we have MDCC. Hmm? MDCC. Now, those of you in a school called McDonough, you have McDonough Central Choir. So when you now remember MDCC, you now remember McDonough Central Choir, where M is for mediastinal plural, D is for diaphragmatic plural, C is for cervical plural, and the other C is for costal plural. Now, there is no day, no week, no time you will not hear of MDCC. MDCC. Now, for those of you who are not in McDonough, okay, you are in Nigeria, okay, even if you are not in Nigeria, you heard of NDCC. NDCC. Now, instead of NDCC, we now said MDCC. Now, don't forget, this is how we study upper and lower limb. This is how we study the thorax and the joint. This is how we study the diaphragm and some beautiful things there. For example, in the thorax, when we're studying the thorax, we say Jack, sieve in. The Jack, J there was for joint. And we said there are about 6 joints or more. We said 6, sit, 6. SMS. Now the sit, normally sit is spelled SIT, and the 6 should be spelled SIX. But our sit in joint was spelled CIT, and our 6, number 6 in the joint was CIX, to help us capture those joints. Are you following it now? Now that way we can remember those joints. You see now? Now that's what we are talking about. Let's tap the limbs. Let's tap the limbs. Very important. Okay, as we're talking about these things, we're talking about the little things. We said MDCC. So we're talking about the parts of plural. We talk about what? MDCC. So you that may not know of McDonough Central Choir, which is MDCC, that's how they call the abbreviation. Usually when they say MDCC, they said, it is as I will not tell you. Okay, I will not tell you what they use to respond. So that's by the way. Okay, now you can say NDCC. The you know it's not Niger Delta. It's not Niger Delta Commission. Okay? NDCC. It's not that Niger Delta Community Commission. Okay, whatever that it stands for. Okay, but it is MDCC. That is mediastinum plural, diaphragmatic plural, cervical plural, and costal plural. Now let's pick the cervical plural. The cervical plural is divided into 3 membranes which seals the apex. The first one, okay, is the suprapleural membrane. Suprapleural membrane. Okay, so we call this SPV. SPV. This is the suprapleural membrane, and this is the parietal pleura, and then this is the visceral pleura. Okay, you see it now? Now, said the cervical pleura is dome shaped, covering the apex of the lungs. Apex, because the lung apex is close to the cervical structure. Moving away from there, okay, we said the in the cervical region, 1 inch above the medial 1/3 of the clavicle. Can you imagine that? Let's take that again. Cervical pleura, okay, pleural cupola. So the cervical pleura can also be called the pleural cupola. The pleural, this is good MCQ question. Pleural cupola. Just like we talk about, okay, in the pectoral region, okay, we talk about the the supra, talk about the suprasternal notch is also called what? Jugular notch. Okay, a suprasternal notch is also called a sternal notch. Okay, let's make progress. Let's make progress. We said the cervical pleura is a dome shape. What else was dome shape that we talked about? The diaphragm. You see how this we are tapping these things, we are connecting. As it connects histology, we mentioned to you. As it connects this, we mentioned to you. Okay. Now, he said it covers the apex of the lung, which is located in the cervical region, 1 inch above the medial 1/3 of clavicle, 3 to 4 cm above the first rib. Can you imagine that? Imagine that. Meaning your lungs, okay, extends closer to the cervical vertebra. Not your lungs, the cervical pleura. That's the meaning. That's the meaning. So you don't hit someone by the neck, right? Can cause pleuritis. The fluid can reduce and inflammation starts. Okay? Don't play those kind of play. Yeah. So we study to know, we study to help. So the cervical contains SPV, all right? You know of PV, all right? SPV, like senior prefect voters card, SPV, right? Suprapleural, okay, membrane, parietal membrane, parietal pleura, and visceral pleura. Okay. So the cervical pleura consists of three membranes which seals the apex. All right, as a pleura, pleura, and all that. Now, what's the function? The sealing of the thoracic cage, forming pressure on the thoracic cage that is crucial for breathing. Intrathoracic pressure. Do you follow? So it is this cervical pleura that seals the thoracic inlet. Okay, seals, no, not the inlet, it seals the thoracic cage, the cervical pleura. It seals it, closes it, okay, making intrathoracic pressure, okay, making for intrathoracic. Wow, this is wonderful. This is wonderful. All right. Are you learning something here? Drop in the comments if you are doing something. Subscribe and like. Share this video. Recommend it to a friend. Share it to other medical platforms. Now, see how we are learning it small. We started with the meaning of plural. After that, we talk about the pleural space, sometimes pleural cavity. Pleural is divided into two viscera and this. We say why it's called potential space because it adherent. Okay, the two layers, they are directly adherent. Okay, with no intervening space. However, we say there is a narrow space that can even make those two layers to be apart, be separated. Then we talk about the 5 clinical significance of the pleural. We said PHEP, PHEPP, PHEPP, PHEP, all right? P for pleuritis, inflammation of the pleura. H for hemothorax, when blood comes into the pleural sac, that potential space. E for empyema, empyema, let's put it that way. Empyema, we have ependema. This one is empyema, okay, embamont, empyema. All right, you say it, open your mouth, say it. That's how you practice, you say by saying, see it, empyema. Yeah, what is that? When pus comes into that potential sac, a potential space, that pleural space, which we say has serous fluid. That serous fluid normally should be about 5 to 10 minutes, and its purpose is for lubrication only. But for pathological case or pathophysiologic case, we say it can cause other trouble in the kingdom. All right. Are you following? Now we talk about parts of plural. Parts of plural. And what do we use for the parts of plural? We said MDCC, Madonna Central Choir, okay, or NDCC, Niger Delta. Okay, oh, that thing used to be NDDC. So this one, no, is NDCC. Just take Madonna Central Choir, okay, Madonna Central Choir. Okay, and if you have a nice mnemonics, you can put it just to remember something you are used to every day. Something you are used to every day, because once they are talking about people in that school called McDonald who are joining to and watching and listening to this, okay, they know McDonald's Central Choir. There is no week they don't know it. So as they see, oh, MDCC, and they will answer. They say, name the answer. Should I tell you? I won't tell you. Drop in the comments if you want to know. That's, by the way, all work no play that's job born. Okay. M for what? Mediastinal plural. D for what? Diaphragmatic plural. Okay. C for what? Coastal plural. And the other C for what? Cervical plural. We say cervical plural has three membranes: suprarenal, suprapleural membrane. Next one, parietal membrane and visceral membrane. That's SPV. Okay. Now let's move on. Let's move on. Okay. All right. So let's move on. We needed to move on very importantly. We are done with the parts of the plural. Okay. Of course, you may note what the diaphragmatic plural is covering the base of the lungs located above the diaphragm. Mediastinal plural covering the mediastinal surface of the lungs. Okay, we are going to see the mediastinal surface of the lung where the parietal and the visceral layers adhere to each other, forming a sleeve around hilum, around the hilum. Okay. So another thing to take note is hilum, because we are going to see that again. Hilum of the lungs. Okay. Around the hilum, okay, giving rise to pulmonary ligament. Okay. Okay. Rise. So meaning mediastinal plural give rise. Okay. Mediastinal plural, we said MDCC. This one leads to the which kind of ligament? Pulmonary ligament. Pulmonary ligament. Okay, let's continue. Next thing we talk about is the coastal plural. This plural, what's so special about this plural? This plural, okay, this plural is between the ribs and the costal cartilage. So the mediastinal plural covering the mediastinal surface of the lungs. Diaphragmatic plural covers the base of the lungs below the diaphragm, the base of the lung below the diaphragm. And then the costal plural is between the ribs and the costal cartilage. All right. Let's look at parts of plural again. As we look at the parts of plural this time, we're looking at the clinical significance of the parts of the plural. The first one is that the clinical importance of the cervix. What does the coastal do? The coastal covers the ribs, okay, covers the ribs and costal cartilage. The mediastinum covers what the mediastinum part of the lungs, where the two layers, okay, adhere to each other, forming a sleeve around the hilum, giving rise to pulmonary ligament. Okay. So we said the cannula is inserted in the, let's do it this way. Okay, I think this is a lovely diagram. This diagram is going to help our life. Let's look at the diagram a little. Space for the roots of the lungs. Pulmonary ligament. See the pulmonary ligament we talk about? Mediastinal part. Are you seeing it now? Diaphragmatic part. Are you seeing it? Okay. Cervical plural. Are you seeing it? A little bit. You said 3 to 4 cm above the first rib and 1 cm above the medial one third of the clavicle. That's the cervical plural. Okay. Okay. It's from Gray's Anatomy. Okay. Now look at the costal part. Costal plural. Look at the diaphragmatic. Okay. Do you follow? Thumbs up if you are following. All right. Move on. We're still making progress. Now watch what is happening here. Watch what is happening here. Okay? Right subclavian vein approach based on bony landmark. Right subclavian vein approach based on bony landmark. Now, let's come back home. Looking at the clinical significance of the pleura to the specific cervical pleura. All right. So we are in the clinicals now. We said a cannula in vein can rupture the pleura, resulting in the collapse. Can you imagine that? Routinely, setting the cannula, a chest X-ray is done to make sure the lung is still inflated and not collapse. If it's collapsed, an intervention should be done. See what we're talking about? That's a very this medicine now. What to do medicine and so we've seen some of the things we talked about. The groove. What else did we talk about? Parietal surface. All right. So let's move on. Let's move on. We're making progress. Hilum of the lung. You know, I said we are going to look at the hilum of the lungs. Now, hilum of the lungs, okay, as the next point, you write it down. Hilum of the lungs. Anatomical location T5 to T7. T5 to T7. Remember, when we talk about thorax, with T1 to T4, we have mass. Mass. People are saying mass a lot. M for man. M for what? Mandible. A for what? Aorta. Okay. And S for what? Sternal angle of Lewis. That was for the superior mediastinum. T1 to T4. Now T5 to T7, you are seeing hilum of the lungs. So as we talk about vertebral levels of the thorax, we didn't just talk about it to throw it away. It's connected. All right? Now, the same way, see what we just talked about now. If a cannula is inserted to the right subclavian vein, and one is not careful, it can collapse the lung. And that's why each time it is done, X-ray is done to check. And you know why cannula is inserted? So injections can be done. Are you following? Yeah. Good. So at the hilum, the parietal and visceral layers blend together surrounding the hilum, ending as pulmonary ligament. We've already said this. When we talk about what? The cervical is divided into three: suprarenal, suprapleural membrane, parietal, and visceral. Okay, good. Look at it again. Look at it. The suprarenal membrane, we said, is adherent with the Simpson fascia. The Simpson fascia. Now, the mediastinal pleura, okay, is in such a way that the two layers adhere to each other, join to form a sleeve, and that sleeve is pulmonary ligament. Are you seeing now? I'm talking about where you have the hilum of the lungs. Okay, hilum of the lungs. And check the picture showing you the hilum of the lungs. You see? Hilum of the lungs. See now? See the pulmonary ligament? How the hilum of the lungs? See? Pulmonary ligament? Beautiful. Now let's see this other structure. We're still looking at mediastinal pleura. I continues to be pulmonary ligament. Are you seeing it? All right. We learn, we capture. Now we are learning it slowly. When we time for live session with a guest, we'll be rushing it. And now we are picking it little by little. Okay. Let's move on. We have talked about the hilum of the lungs. We said the hilum of the lungs, okay, is between T5 and T7. We said the visceral and the parietal pleura, okay, adhere to form what? Pulmonary ligament. Adhere to form what? Pulmonary. All right, we'll move on to reflections of the pleura. Reflections of the pleura. In these reflections of the pleura, we have the extent of the pleural cavity. So you have to mark the extent of the pleural cavity. Now, there is costodiaphragmatic recess. Recess is a reflection between two types of pleura. So as you talk about reflection, we're talking about recess. So if they say let's go for recess, let's have a recess, means let's move, let's reflect. Do you follow? I remember one of the English, my primary school friend once spoke, you are just studying, and they said, during the time for recess, we'll do it. And what that means is that he's talking about break time. And remember, I'm not a white person, so I don't really understand. Okay, others speak English there. Okay, so you have costodiaphragmatic recess and costomediastinal recess. What does it mean? The angle where the costal pleura meets the diaphragmatic pleura. Costomediastinal is the angle where the costal pleura meets what? The mediastinal pleura. Is it not simple? Don't give someone your plural. Don't break somebody's plural. All right, we move on. See where we are starting from and see where we are now. This is the fourth point. Okay? Now, we are about 45 minutes into this. Whereas if we were to run through this, it won't take 45 minutes. Now, we're talking about reflection. Reflection simply means the recess, costodiaphragmatic recess, and costomediastinal recess. CDC. CDC, or CMCD, CDC, CDCM, CDCM, CDCM. Okay, so we have CD, we have CM. Okay, the angle where the diaphragmatic. So let's look at this angle. Look at the picture. Mid clavicular line, mid axillary line, costo-mediastinal recess. Did you see it? That is where the costal cartilage reflects to meet the mediastinum. Reflect to meet the mediastinum. Now watch this. Costo-diaphragmatic, where the costal cartilage reflects to meet the diaphragm. Okay. We're done with that now. So we've talked about reflection. What else have we talked about? We talked about hilum. What else have we talked about? We've talked about the parts of pleura. We talk about the clinical significance of the pleura. And we talk about introduction of the pleura. Those are the things we've talked about. Look at it. Hilum, parts. That's it. Parts of pleura, clinical significance. That's what we've talked about. Okay? Now let's pick the fourth one. So for pleura, we said, as we talk about pleura, we talk about introduction. We must talk about the meaning of pleura, pleural cavity, pleural space. So you can't discuss pleura if you don't mention these things. And then you talk about the parts of pleural, which is you have SPV. Okay? We have the CPV. Is this CPV? We have the cervical pleural. We have the what do we have? Can you answer? Ability to recall, not just to run through. You are not lecturing from book. We are also capturing from book. Okay? Yeah. So, okay, which one do you remember? Okay. All right. So we have diaphragmatic pleura, mediastinum. So we have costo-mediastinum, costo-diaphragmatic. Sorry, we have mediastinal pleura, yeah, and costal pleura, cervical pleura, mediastinal pleura, diaphragmatic pleura. Okay, cervical pleura, diaphragmatic pleura, where we say MDCC, mediastinal pleura, diaphragmatic pleura, costal pleura, and cervical pleura. MDCC. You see, this is another thing. You must learn it this way. Okay, now let's talk about the parts. Okay, that was the part. In the cervical, we have three things: suprapleural membrane, parietal membrane, and cervical membrane. The suprapleural membrane is the one that adheres to the Simpson fascia. Look at it. And then which has to do with which pleura has to do with, there's something we talked about. Can I recall it? Okay, where we say hilum is a mediastinum pleura. Yeah, where we said the mediastinum pleura in such a way that the parietal and the viscera, okay, will later form a sleeve, which will now continue as pulmonary ligament. Good. Can you also say like that? Talk about the meaning of pleura. Can you talk about the parts, okay, and the sub parts of one of the parts? Can you talk about the clinicals where we say PHEPP, PHEPP, pleuritis, inflammation of the pleura, hemothorax, which is blood in the pleural sac, and then pneumothorax, which is A in the pleural sac, and then what else? What else? So it's very simple. We have pleural effusion. Pleural effusion. All right. Now this is how to internalize by saying it over and over. So I'll give you 1 second, 1 minute. Try to pause this thing now and go through. I'll be watching you while I take my water. All right. So which one were you able? Have you finished? Now, tonight we are going to bring in a guest. I would like you to be our guest. Okay, if you can, any of you can be our guest. I'm trying to create a scenario where we can have more than one guest. For now, we are managing one guest. Okay, we want us to subscribe. Let's subscribe. Let's share. Let's show interest in being guests. Okay, in this live session. So that way, I'm thinking of how we can bring in 3 to 5 guests, okay, in the live session. We have more than one person joining the live session. Do you follow? And they are guests, just like it happens in Google Meet. Okay. All right. So where are we now? We are on the reflection. How do you call this reflection now? Recess. Reflection of the plural. Recess. So we have costodiaphragmatic pleura, that is the angle where the costal surface or the costal pleura, okay, meets with the diaphragm, meets with the diaphragmatic pleura. Okay. If you move and this one meet, or if you breathe and this one meet, are you getting it now? He said where we have costomediasternal pleura, a postomediasternal recess. Okay, where the mediasternal pleura meets with the what? Costal pleura. Hope you are making sense. I'm saying all that from my head. So we have 4 things now we've learned from our head. Let's look at the fifth one. Surface anatomy of the pleura. Surface anatomy of the pleura. Now, exactly 1 hour into this session, we are going to pause pleura and we go to upper and lower limb, because we're saying tap your limbs. So that wouldn't be complete if we spend 2 hour live session and we don't tap the limbs. We've tap it, but we have to tap the limbs. Do you follow? Okay. Remember, here we learn in piecemeal. We learn in piecemeal. We don't want to finish, oh, in this session we finish this material. Well, there's going to be a session like that. But for now, we are internalizing. Okay? So that when that session comes, we can analyze so many things, question and answer. Okay? Or maybe learn a very few details added to what we have done. Are we together now? All right. Let's continue. Now, we're looking at surface anatomy of the pleura. So what are we looking at? Number 1. Okay, let's put it this way. Lapa. La. Pala or lapa. Which one? Palava or lapava. Okay, because we have L there, we have P there, we have A there. Pala. Lapa. You have Japa. This one is Lapa. Okay, so a lap. Okay, let's put it this way. A lap. Okay. A lap. So surface anatomy is what? A lap. It's a laboratory thing. Okay, let's put it that way. A lap. You see, now we are internalizing, but learning is not really okay. To coin the brain, to think of an easier way of getting this. Okay. So surface anatomy, A there is apex of the pleura. L there is lower border. A there is anterior border. And P there is what? Of course, posterior border. Now this sound like Paul. Posterior, anterior, upper, that's the apex, and lower border. So see Paul again. We have Paul again. Paul was in superior thoracic aperture, SAT or star. And now we are seeing Paul again. Apex, that's the upper, the lower, the anterior, and the posterior. Paul. Paul. So you have Paul in thorax, you have Paul in lungs. Come on. Paul in plural of the lungs. So we say the apex of the pleura is 1 inch above the medial 1/3 of the clavicle. We have already said that. And then 3 to 6 inches above the first rib. Very important. Apex as the cervical pleura is 3 to 6 inches above. You need to check that. We have done that before. Look at it. Look at it. Is it 3 to 4? Okay, this is 3 to 4, not 3 to 6. So it's 1 inch above the medial 1/3 and 3 to 4 cm above the first rib. Do you follow? Thumbs up if you are with me. Good. Drop in the comment section. So we continue. We said the plural, okay? So we are talking about the anatomy of the plural. And we said Paul. Either we said Paul or a lap. A for apex of the plural. L for lower border of the plural. The other A for the anterior border or anterior surface of the plural. And then this other one for the posterior border of the plural. Do you follow? Do you follow? Yeah. Okay. So what did you follow? Let me hear. The anterior surface of the lap. So we continue. As we are continuing, we said the plural, okay, has on the lower border, we have the main difference between the lungs and the plural. Lower border, the lower border, main difference between the lung and the plural. Posterior border, the same as the lung. Anterior border from the apex to the sternoclavicular joint, downward to the level of 7 costal cartilage, instead of 6 in the lungs. On the left side, beside the 4th and 6th costal cartilage, there is a cardiac notch also present in the lungs, okay, where the heart come to insert its ventricles. Okay. Now, the important thing here is, because remember, there's a video we said for every anatomy, there is something that the examiner are after in that your heart. So don't give somebody your heart to, don't take somebody's heart to, don't break somebody's heart to. The same thing with plural. Okay. The important thing here is the pole, posterior border, anterior border, upper or apex border, lower border. That's all. Next one, we look at the surface anatomy of the plural. Before we look at the surface anatomy of the plural, ladies and gentlemen, we'll be looking at joint. Let's pause here. We have a whole lot. How many points do we have here? About 12 points. We've taken 5. Can we take 6 before we move to joint so that we know we took half? All right, let's see. Suprarenal membrane. Okay, will be the 16th. So the 5th one is surface anatomy of the plural. The surface anatomy of the plural, we have the lung, plural, needle placement in pleural effusion. That is especially for the lower border in the lung and plural. Okay. Clinical importance of the lung and plural surface anatomy. In the case of pleural effusion, the needle is inserted for X in the mid-axillary line. Is inserted for extraction in the mid-axillary line. You can see the mid-axillary line here. Look at it. You see, that's the mid-axillary line. Good. Now, that's where you insert in case of pleural effusion. What's pleural effusion? If there is fluid in the pleural potential sac, all right, you insert, okay, insert the needle there, mid-axillary line, okay, which is between the 8th and 10th rib at the level of 9th intercostal space. 8th and 10th rib at the level of 9th intercostal space. Clinical importance of cardiac notch. In the case of cardiac tamponade, fluid in the pericardium around the heart, the needle is inserted in the cardiac notch to aspire fluid, avoiding the injury of the lungs. Are you seeing it now? So, what do we gain from this surface anatomy? We have tamponade, cardiac tamponade, which is fluid in the heart. Fluid, okay, in the pericardium around the heart. The pericardium. Okay, this is beautiful. Long 1 hour on this concept. Long 1 hour on this concept. Cardiac tamponade. What's cardiac tamponade? It is fluid, okay, in the pericardium of the heart. And as we look at surface anatomy of the plural, okay, the important thing is if there is fluid, okay, in the way, in case of pleural effusion, that is fluid in the pleural sac, okay, you insert it, and we have pleural pneumothorax, 8th and 10th, okay, between the 8th and 10th 8th and 10th ribs at 9th intercostal space. The 9th intercostal space. Okay. Between the 8th and 9th rib at 9th intercostal space. Okay. Question, do you know what is intercostal space? If you are doing it from mid-clavicular line, now watch this. If you are doing it from mid-clavicular line, it's going to be 7 intercostal space. Okay, mid-clavicular line, mid-clavicular line is going to be 7th intercostal space. If it is mid-axillary line, it's going to be 8 intercostal space. Ninth intercostal space. If it is posteriorly, it's going to be 11 intercostal space. Now, the 7 intercostal space correspond to the 8th rib. The 9th intercostal space correspond to the 10th rib. And the posterior, which is 11 intercostal, correspond to the what? To the 12th rib. Are you following? So needle placement in pleural effusion is 7 intercostal space for mid-clavicular line, intercostal space, mid-axillary line, and 11 intercostal space, which is what? Posteriorly. Very important concept. I wouldn't want to leave this here. They will end this business. Okay? Now, moving away from here, we have what? The joints of the upper and lower limb, the bones, the muscles, and all that. Now, the muscles is usually the most difficult part, okay, in upper and lower limb. So we want to take that. Okay? Let's start from there. Before we do that, let's run through what we have done. On what? The surface anatomy of the pleura. And in the surface anatomy of the pleura, we said needle placement in case of pleural effusion lower border in lung and pleura is that either the 7 intercostal space or the 9th intercostal space or the 11 intercostal space, that is for mid-clavicular or mid-axillary or posteriorly. Now, for the pleura, we said the 8th rib or the 10th rib or the what? The 12th rib. Now, that is the descends 2 spaces below surface anatomy of the lungs. Pleura descends 2 spaces below surface anatomy of the lung. And what's the surface anatomy of the lung? We say Paul in NJ. P for posterior, A for anterior, U for upper or the apex, L for the lower. Okay, lower. Usually lower lateral. So lower, leave lateral is for the other one. Okay, thoracic inlet. All right. Now, that apex, what do you find? He said it is 1 inch above the medial 1/3 of the clavicle. This is the medial 1/3. Look at it. Look at it. The medial 1/3 towards your neck. Lateral to third, away towards the shoulder. Away from the neck towards the shoulder. So this is lateral. This is medial. Okay. Making progress. Do you follow? Thumbs up if you are with me. Press the thumbs up button. Drop on the comments if you are following. We are making reflection. And then the anterior border, what do we have? Sternoclavicular joint, very importantly, the apex, foot and 6 costal cartilage, cardiac notch. You follow? Especially on the left side of the pleura. Okay, anteriorly, you have cardiac notch, where the heart inserts. Okay, you follow? Okay. Move on. Next one, we talk about the posterior. Okay, the posterior border is the same as the lungs. Lower border, main difference between the lung and pleural. That's where you have major difference. It's a detail in the upcoming slide. So now, here's the point. We talk about reflection of the pleural. And we said we have CDCM, that is costal diaphragmatic reflection. It is the angle which the costal pleural meets the diaphragmatic pleural. Do you follow? Yes. Good. Now moving away from the costal mediastinal pleural is the angle in which, that is when the diaphragmatic pleural move. All right? It meets with what? Costal pleural. So as you are breathing, as you are doing exercise, once there is reflection, when there's a movement, it's called, that reflection is called recesses. Recess. It's different from abscess, so this one is recess. Okay. Recess is the reflection movement, okay, between two plural types of plural. And then after we talk about, so we've talked about surface anatomy, how important in needle, all right, both the plural, tracing it from the rib, mid clavicular, mid axillary, or tracing it from posterior, or tracing it with the intercostal space, either the 7th or the A9 or the 11th. See how it is based on 2, so it's not something you cram. This one is 7, 7, 8, 9, 10. Oh, this is beautiful. 7, 8, 9, 10, 11, 12. Again, 7, 8, 9, 10, 11, 12. The 7 is the 7th intercostal space you insert the needle to extract fluid or A from the pleural sac on the lower border of the pleural. Okay? So don't forget, the anterior border, we said, you talk about the sternoclavicular joint, you talk about the cardiac notch, 4 to 6 rib. Those are the things that you find in the pleural, 4 to 6 rib. Okay? 4 to 6 rib. All right. So the lungs goes as much as from the 4th rib to the 6th rib anteriorly. Then posteriorly, the pleural of the lungs, okay, goes, we said, 3 to 4 cm above the first rib, but only 1 inch above the medial clavicle. Medial 1/3 of the clavicle. Are you following? You are still internalizing. So you should say with us as we're saying, you say it. Okay? So there's anatomy of the lungs. Okay? So the anatomy of the lungs. The whole clinical importance is when you are inserting, in case of cardiac tamponade. Cardiac what? 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 Tamponade. Good. Now, this is how you sing it. You know, this is teaching session. When you were growing up to be an intelligent student, you must go to nursery school price where they sing it to you over and over. So that is that about the plural. Okay, we are soon ending very shortly. Yes, so you prepare for the next session by 9 p.m. It's going to be amazing. Okay, we're going to have team of guests joining us. Okay, all right. I'm planning to make sure we have at least maybe more than one guest tonight. We've been having one guest all this while. Let's see if we can have more than one guest to teach. So if you want to be a guest, make such course mastery. That's a public YouTube channel, a public WhatsApp channel. Or you drop in the comments, I want to be a guest in the live YouTube session. Okay, drop your mail or your WhatsApp number. We will contact you. Okay. So you show your face and talk to us as we teach you, or you share with us what you learn, because we believe you are watching this. Okay, you are going through this, you are learning this with us, you are taking notes. You should be able to tell us what you learn. What you learn about pleural, yes, introduction to pleural, pleural cavity, pleural space, pleural serous fluid, good. Now the clinicals, okay, the pleuritis, fib, the hemothorax, empyema, empyema. Okay. Two strange things today that I've learned in this material: cardiac tamponade and empyema. It sounds like meat pie. We do a lot of things when we internalize. When we present in a short 7 video, say, learn anatomy of the lungs in 7 minutes, in 5 minutes. You think it came in 5 minutes? See how much it takes us to think of a lap, Paul. Connect a lap and Paul. MDCC, Madonna Central Choir. Come on now. SPV. Do you know this wonderful thing? CDCM. CDCM. All right. Then we talk about parts of product. Don't cut your tongue. Parts of plural. And the parts of plural, we said we have mediastinum plural, diaphragmatic plural, costal plural, and cervical plural. The cervical plural, we have the suprarenal plural, where it adheres with the Simpson fascia. Yes. We have the parietal plural, and they say, so we call SPC. SPC. Good. Still making progress. I think those are the things you've done. Number 1, surface anatomy of the plural. 1, surface anatomy of the plural. 2, reflections of the plural or recesses. Parts of the plural. Clinical of the plural. What else have we done? Introduction of the plural. Hilum of the lungs. Ooh la la. And we say the hilum of the lungs. That's almost about 8 things we've done today. 8 things. So we are going to pause it. If possible, sing it through again. Please join the studio, the workshop, study workshop, and the study shop, and the study studio, and drop what you've learned. This is almost an hour, 30 minutes. Okay, and we're going to pause it. You're able to join and talk to us. Okay? Tell us what you've learned. Like now, open fresh page. Open fresh page. Yes, this is my fresh page. Hey, open fresh page. You're studying with us. Okay? Drop your candid here. Open fresh page and write what you've learned from today's class. Fast. Yes, everybody, drop what you've done. Hey. Drop what you've done. Yes, you too. Drop what you've done. Open fresh. Me, I'm opening mine. Yeah. What have you learned from this video? I test myself after every class. And when you are done with the test, you share it in discussion. When you are discussing. Guy, I'm waiting for you, bro. Come on. Take a piece of paper. Write what you've learned. Screenshot, send to the studio shop. Okay, display your write-up. He says, don't find it to go and read again. My brother, drop it. Start something if you want to be a star. I'm starting my own. I've learned about introduction to the plural. I've learned about parts of the plural. I've learned about recesses of the plural or reflections of the plural. I've learned about what other thing? Clinicals of the plural. Okay. I've also learned about the clinical of the cervical plural or suprarenal suprapleural membrane. Clinicals of the suprapleural, where you need to put the cannula through the right subclavian vein. Good, right subclavian vein. What else have I learned in this plural? I've learned the surface anatomy. Surface anatomy, where I learned cardiac tamponade. All right, so we move on. Oh, you're going to miss into kingdom. So we said, I've learned that. That's what I'm recalling. So write your own surface anatomy where I learn the cardiac tamponade, surface anatomy, where I learn where you insert needle, okay, insert needle from the mid clavicle first, then mid axilla, then posterior 7, 11, 7, 9, 11. Then from the pleural is going to be 8th rib, it's going to be 10th rib, it's going to be what? 12th rib. Okay, if you're talking about posterior 12th rib, you're talking about mid axillary 10th rib, mid clavicular is 8th rib. Good. This is where we are going to stop that. This is where we're going to stop it. I've learned all this 1, 2, 3, 4, 5, 6, 7. 7 beautiful things. One, where is it now? Where is it now? Let me start counting. Beautiful things I've learned. 1, 2, 3, 4, 5, 6, 7, 8, 9. Wow. That is the hilum. Hilum. Hilum of lung. Hilum of lung. Okay. Hilum of lung. Hilum of lung. Parts of plural are 3. Hilum of lung. Okay. All right. So that's the thing we've learned today. And as usual, we are going to create a short video. Okay, please watch it. I'm going to create a short video telling you what we have learned in today's class. Okay, and we are going to bring it out on a beautiful write-up, beautiful. Okay, and we send it. You do your own. You do your own. You can use an AI to do it. You can use Canva, all right, to do it. Canva, VCAVA. Canva to do it. You can use AI to do it. But if you are using AI for any animation or write up, let it give you reference and citation. Okay? Or you use a material, very important. This is another secret I've told you now. Yes, another secret I've told you now. If you are watching this video to this point, this is, like now, I generated a mnemonic. You can use AI to generate mnemonics. Give me Christian religious based mnemonic. Can tell you, give me education based mnemonic. Can tell me, give me a so and so, maybe give me food-based mnemonics, football star-based mnemonic. Can tell him, give me agriculture-based mnemonics. Okay? Yeah, that's how you learn. Mnemonics are the hanger in which you drop your thoughts. Like now today, I have learned what? See, I have learned what? Introduction, parts. The parts is 3 things I've learned. Both the each other part, the parts for the cervical, the parts for the so that's that. So parts, I've learned what? Clinicals of parts, okay, IPC. Next one I've learned the surface anatomy. Surface anatomy. I've learned what again? The reflexes or the reflections. Before the reflections, can talk about the what? The hilum. The hilum, and then the reflections. Okay, and then let's look for a letter and put it to make sense. Yeah, what letter we put in there? What letter we took in there? IPC sharp. Hilum of the IPC shop. Good, let's put it that way. IPC shop. You know what IPC is? Independent Power Company. It's in the city where God lives. Okay, in the giant of Africa country. Akwa Ibom State. IPC is there, that company is there. So if you are not used to it, IPC, you can use another acronym that you're used to. Okay? So IPC shop, I stands for introduction, P stands for what? Parts, C stands for what? The clinicals, S stands for what? The surface anatomy, H stands for hilum of the lung. Sorry, HO stands for hilum of the lung, and the P stands for what? The say sharp. You've not seen reflection. No? Sure. Which one is P again? Parts. Already talk parts. Parts. What else? Talk about parts. So let's be sure. IPC sure. Reflections of the plural. Okay, shock. shock. Okay, so let's put it that way. IPC sure. IPC sure. IPC is sure. That's Independent Power Company is sure. Good. So reflection. Those so one, two, three, four, five, six, seven. Seven things we have learned today in this session as we talk about let's tap the upper limb. Now let's look at the upper limb. Wow. We have talked about the thorax, we've talked about the lungs, okay, not really lungs per se, but the plural of the lungs. Now let's talk about the joint. Don't forget in the upper and lower limb, we said there are 48 topics there, and you can study under sub 17 subtopics. Why? Because they devote 6 weeks for different kinds of bones. Yet we said you study bone in one pattern, one same way, just one way. Okay, you study bone in just one way. All right. And what is that one way of studying bone? You use the mnemonics. I draw perfect picture showing some big mysterious brown lion on Jasper field, excluding sparkling cities. Excluding sparkling city. So I'm going to write that down and tell you what it means. I draw perfect picture showing some big mysterious brown lion on Jasper field, excluding sparkling city. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. A 17 is S. I I draw. Okay. I draw some perfect picture showing big mysterious lion hand. So I they stands for introduction. Okay. Draw stands for diagram. We say there should be 5 to 10 diagrams. And then parts here stands for what? And perfect here stands for parts. You should list the parts of your structure. Picture here stands for what? Position. And then surface here. Okay. Some. Showing stands for what? Surface. Some stands for what? Side determination. Brown stands for border. Okay. Mysterious stands for muzzle. And then brown stands for what? See, I'm writing as I'm reading and writing. I'm not reading from it. Okay. And then brown stands for blood supply. Lion stands for ligament. And then on stands for circulation. Okay. Jasper stands for joint. Field stands for features, special features. Special features. All right. Excluding stands for ends or extremity. Sparkling stands for what? Shaft. And then city stands for clinical relate. Now let's look at for joint. Joint is I always see I always see born again disciple teaching all Christian love. Bible reading now more accurately. Now, what does it mean? Let me write it in a minute out so I can bring out what it stands for. I always see born again disciples. Always see born again disciples. Hey, close your ear. Don't hear my own. I'm saying my own. I have a study partner here. Okay. So I always see born again disciple teaching all Christian love. Bible reading now more accurately. I always see born again disciple teaching all Christian love. Bible reading now more accurately. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. I always see born again disciple, teaching all Christian love. Bible reading now more accurately. Okay. Remember, I always see various born again. That's what he said. I always see various, but it used to be 15. I always see various born again disciples teaching all Christian love. Bible reading now more accurately. I stands for introduction. Always stands for articular surface. Okay. The other all will stand for articular structure. Then this one stands for stability. Let me take some water. And we're going to shut down this very shortly. And we said, I almost do what? I always, okay. I stand for introduction. Always stands for, I stands for introduction. Always stands for particular structure. The all stands for particular surface. C stands for stability. Various stands for venous returns, venous drainage. Then born again stands for bossa. Disciple stands for diagram, for sketch diagram, everything you're doing. Type stands for type of joint. And then love stands for ligament. Okay. Bible stands for blood supply. Okay. Reading stands for relation. Noun stands for net supply. Mo stands for muscle. Accurate stands for blood supply. Do you follow? Now let's learn it for muscle. Okay, because I said muscle is the most difficult. Muscle is the most difficult to because you have several. Imagine like we talk about diaphragm, the chief muscles of the respiration. Okay, let me take some water. All right. Thank you so much. You need water to do this. It's not a small work. Okay, so muscle is the most difficult. So let's look at muscle. How do you taught the muscle in upper and lower limb? Because muscle is the next thing we are looking at. Okay, we have internship students. Watch this now. We said internship student one, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12. Internship student doctors take only important action before nurses can leave clinic. What does that mean? Internship student doctors stand for introduction, shape, and diagram of that muscle. Now, take only important action stands for types of muscle, origin of muscle, insertion of muscle, and action of that muscle. What's the function? Like we talk about the diaphragm, okay? If you watch a video, which you should watch, okay? If we talk about the diaphragm, the action of diaphragm was summarized into what? MDX, sorry, MDPVC. MDPVC, where M is the word micturition. Actually, diaphragm helps in micturition, that's urination. It's the muscle when you push the urine, it's the diaphragm that help you push abdominally. Damn word. When you defecate, say, in the toilet, it is diaphragm that helps you do that. And guess what? Diaphragm has 3 origin. CVS. All right. Insertion is the central tendons. The body and the anterior body and the intervertebral disc of the L1, L2, and L3 is the right cruise of the vertebral origin. Posterior to the xiphoid process is the sternal origin of the xiphoid. And then we have the costal origin. Inner, watch this now. Inner lower 6 ribs. Inner surface of the lower 6 rib. Inner surface of the 6 lower rib. It's not really. Have you seen why we say muscle gives us a headache? It has a lot of origins, a lot of insertion, and their cause interesting. We didn't even talk about the nerve supply. Diaphragm, artery supply. So that's why we are looking at this. Internship student doctors take only important actions before nurses can leave clinic. Okay, so that's that. Internship student doctor stands for introduction, shape of the muscle, and diagram of the muscle. Take only important action stands for types of muscle, origin of muscle, insertion of muscle, action of that muscle. Okay, a diaphragm, for example, helps in parturition. Without diaphragm, someone cannot give birth. Also, diaphragm helps in what? Vomiting. Without diaphragm, cannot vomit. Yeah. Think of what you can do without that. And then see the chief respiration. Without diaphragm, there can be no chief respiration. Whether inspiration or expiration, it's not possible. Diaphragm. Do you follow? Okay. Let's move on. Now, you see why I'm talking this one fast? Because we have done it. We have done it before. Now, this time is the time for what? Lungs. So in the night, we're going to have live session. Don't miss it for anything. Don't miss it for anything. It's going to be a wonderful time. Once again, thank you for being here. Okay, I've not finished. Before nurses can leave clinic, before stands for blood supply, nurses stands for nerve supply, can stand for cause. Between origin and insertion, there is a cause. There's a pathway. All right? Okay. Leave there stands for liaison. And then clinic stands for clinicals. Okay. That's that about muscle. And then we started with bone, scapula. And then we said, we added it with the scapula, okay? We didn't talk about the joints, but we did talk about the muscles of the scapula, 17 of it. And the 17 muscles of the scapula, we use the acronym, okay? The acronym we use is silly intent, try studying. They learn really rare subjects plus difficult tests. Busy tutor late often. That's it for the 17. Silly intent, try study. They learn really plus difficult tests. Silly in a busy tutor come late often. That's all. The often is for homohyoid. The late is for latissimus dorsi. Okay. Busy tutors. Bicep brachii, tricep brachii. Okay. They learn really rare surgery. Trapezius, rhomboid major or rhomboidus major, of course, rhomboidus minor, rhomboidus minor. Okay. Surgery is serratus anterior. Okay. Now, seat muscle. Supraspinatus, infraspinatus, teres minor, subclavicle. No, not subclavicle. Subscapularis. Clavicle is in the other front. Okay, so previous, we talk about the extrinsic muscle of the thoracic wall. Okay. Pectoralis major, those are the muscles. Levator scapulae, those are the muscles, 17 of them. Now, you see this thing I'm telling you, it was not easy. We use mnemonic to hang this. We have to say it slowly like we are saying for this one now. This one we now say IPC sure. I for introduction, P for part, C for clinicals of those plurals of the part, and then S for what? The surface anatomy, H for what? Hilum of the lung, O for what? Oh, hilum of the lungs, and then R for what? The reflections. The reflections. What do you call, what kind of reflection do you call this? Recess. That's when one lung reflects on the other. You follow? So that's what we are looking at. Now, in the evening, it's going to be a live session. Even though it's going to be a live session by 9 p.m., we are still going to start. We are still, because today is 30th, by tomorrow, we should be done with tap. And then we start up and lower limb as a course. We start upper and lower limb as a course. So we are going to be doing so much from 1st of August. From 1st of August, we're going to be doing so much. So very much. So please, ladies and gentlemen, make it a date. If you are first class, you want to maintain your first class all through this is a channel to do it live with me every 9 a.m., 3 p.m., and 9 p.m. All right. Now, if we are going to change it, we are going to let you know, especially the month of August. If we are going to change it, we are going to let you know. So we can have a nice time studying together live. Okay. And making you our host. Once again, thank you very much for making it a deal with us. This is MSC Mastery channel where we appreciate medical concerns and concepts in piecemeal, where we master through stammer, through plaster, through blaster, through caster and haster. Before you know it, we foster everything together. Thank you very much. See you by 9 p.m. Shout out to all my subscribers. Please share, subscribe. Let's reach out to millions of medical students in this country and around the world. Okay, who are struggling with this. Let's build this business together. Is that okay? Promise me you send it to somebody. Okay, I may be DMing you. Don't say, where's my number? Who gave you my number and all that? Please, we are trying to reach out to people. I'm pleading with you. Please give me the number of a medical student. I want to reach out to them. They are struggling, but they don't know. Do you get? Yeah. All right. Thank you very much. See you by 9 p.m. once again. Thank you for being here. We'll do some other things again, and then we'll still do up and we'll refresh our embryology, refresh joints, histology. What we've done embryology so far, we've done that's year one, first in course embryology, year two, first in course embryology, like that. We'll run through those presentation, and then we are going to enjoy ourselves. Okay, much more abdomen, pelvis, perineum. We're going to run through abdominal vessels. We're going to run through the pelvis, that's the true pelvis, the false pelvis, the pelvis brim. We're going to look at the peritoneum, small anterior urogenital triangle, large posterior anal triangle. We're going to look at those things. We're going to look at a whole lot of things this night. So let's make it a deal in the night. Let's see what we can do, because by the beginning of first month of August, we are starting upper and lower limb. We are starting head and neck. Okay, this step is going to be short, cheap. We are bringing in physiology, biochemistry, much of physiology, a little of biochemistry, maybe in 2 days, one biochemistry, but every day it's going to be physiology, there's going to be anatomy, there's going to be epineal. So let's be a part of it. So that's why I want to try to finish thorax, abdomen, pelvis, and perineum. Do we follow? Do you understand? Please thumbs up if you are with me. Ooh la la. Woo-hoo. Thank you once again. I know you've gotten a whole lot of value in this session. It's a pleasure. All right. Bye for now.